Hello, I'm Mabel Jong, and you're watching the World Healthcare Congress Interview Zone. I'm so pleased to have Harry Reynolds here today. He's the Director of Health Industry Transformation over at IBM. Hi, Harry. How you doing?
Hey, great, Mabel. What a pleasure to be back here.
Well, it's a pleasure to have you. I just wanted to say that it's been so exciting in the health industry lately. What are you seeing that's happening that makes you confident that we're headed for a more efficient system going forward?
Well, I have a wonderful job. I get a chance to travel throughout the U.S. and Europe and other countries to really see healthcare at every segment of the industry. In other words, payers, providers, healthcare, life sciences, governments, retail, whether you're talking about the Targets and the Walmarts and the others. So I've been in the industry 45 years. And I would say to you that in the last 24 months, I have seen more significant engagement by the entire industry in healthcare than probably in the last 15 to 20. It is absolutely exciting.
Now, is it because of the deadlines being imposed by the Affordable Care Act that is prompting people to get together, or do they see real significance and value in collaboration now?
Oh, I think it's all the above. I mean, there's no question that some of the government requirements that are out there have prompted people to think and act differently, and some of them have, prompted them to team up. On the other hand, I see more of the private sector actually realizing that they can make a difference in healthcare. Employers want to change, hospitals and doctors are looking at a change, payers and everyone. So you're really seeing people accept that healthcare as it is right now is not what it can be sustainably in the future, and how do we really change that for populations, whether it be in the U.S. or worldwide in that case.
Now, as you said, Harry, you've been doing this a long time, and you travel all over the country all the time. What are some of the most inspiring examples that you've seen?
Well, I won't name names, so that I think that's important, but I would say you're starting to see people really think about team care, really work on the person, with the person being the center of attention, rather than that person out seeking health care and having to go to one doctor and then another doctor and then a hospital and others. People grouping up to help them, and that would include their employer and their payer and others. And so I think it's really about that person now, and it's really about taking care of that person and everything related to that person. We're seeing more and more focus on the social context of a person, because everybody has things in their lives that either add to their ability to take care of themselves or detract from it. I travel a lot. I love working with facilities that have after hours and weekends because I'm not home during the week. And so regular hours would be difficult for me. So the social context I would like to see it in, and I actually have some providers that do that. So that's a personal statement as to how I now can seek healthcare differently.
Very good. Now, what about the exchanges? There is a looming deadline in October that we should be seeing online market exchanges for insurance. Are you seeing that people are getting ready for that?
Yes, people are. Obviously, with many other states, I'm not sure exactly how they're going to participate. It's created a bit of uncertainty, but not a negative uncertainty. Just anytime you have this quick of a deadline, people get involved. But there is an excitement. There's an excitement that it's going to change things. There's also an excitement as to what does that change feel like. We're going to insure more people, but we've got to make sure that the care models and everything are ready to accept them. And I see the entire industry grouping up around that to do it.
A lot of positive activity for sure. Anything that you're concerned about, Harry, that needs to be done and better?
Well, it's not specifically about exchanges or anything. I'll just talk the grouping up of individuals, the convergence, the changing care models, the focus on the individual, better information. All those things have to be in play at the same time. And so some people are moving ahead, other people are trying to figure out exactly how they're going to engage. And so, it's a large industry. It's an industry that has been made up of many, many pieces. As you try to converge those pieces, it starts to create situations that, that create tensions. On the other hand, create opportunities. And so that's what's really, really exciting, is that people are embracing that the tension is there, but the opportunities are there also. And so that's really exciting.
All right. Harry Reynolds, thank you so much for your time today.
Thank you so much. What a pleasure.
Always
nice
a
talking
pleasure.
to you. Thanks.
Thank you.
Take care.
And I'm Mabel Jong. Thanks for watching.